Hi, I'm Dr. Julie Steinauer. In this video, I thought I'd discuss something that we might not think about a lot, depending on the region that you live in, but we definitely think about these things when the Winter Olympics roll around and we're thinking about bobsledding and the skeleton. Those are fun sports to watch, at least for me anyway. But this little set of information kind of comes in the Neuro-Optometric Rehabilitative Association. It's kind of a weekly digest that we get, or an email that we get with a bunch of information, short little things about different studies that are going on, and they're just really paragraphs of information. And this one I thought caught my attention because while again we might not really think about this except Winter Olympics time, there are many sports in which head first types of activities occurs. Not just bobsledding or skeleton, although that's what they were talking about here. They mentioned that these individuals, these competitors, will have problems with chronic headaches, heightened sensitivity to bright lights and loud noises, forgetfulness, and even psychological issues. Now, if we take it and extrapolate it out and say, okay, not just for bobsledding or skeleton, which probably not a lot of people do that in the world, certainly around in our parts here in the US, but there definitely are places that that's a really big sport. It's a really big thing for them. Now, for us though, we might be thinking about a sport that we lead with our head in contact. Football, maybe even baseball, whenever you talk about someone sliding into a base, and the jarring that goes on to the head, the neck, the spine, and everything as the person hits the ground, slides, and then contacts with the base and is jarred slightly backwards. That's actually quite a bit of movement that the head sustains over time. Maybe if someone is doing something repetitively like soccer and they're hitting the ball off of their head in soccer. Maybe you've got someone who, football, obviously, whenever they're doing lots of tackles and that sort of thing, there's lots of leading with the head, although they should lead with their shoulders and their body. But that still is causing a kind of a crunch up of the spine, of the neck, the cervical spine, really the whole back, and then obviously in the head region. So I think that we need to be thinking about these things. Brain experts, according to this, that have studied these athletes, again, we're talking specifically about bobsledding and the skeleton, but I think we can also, again, extrapolate out for other sports that it's kind of there's head sliding or head first types of things. Maybe even sledding. If you think about sledding, someone who likes to sled down a hill head first. Ooh, I think about my son, right? All right, so what happens is it says that they are notorious crashes, routine head banging, lots of brain rattling vibrations, and strong gravitational acceleration forces that are common in this sport. Certainly true. Again, definitely if you think about some of these other things that I mentioned, that's the case too, although maybe not an extreme amount of acceleration, maybe some deceleration that happens as you contact. But they mentioned that some of these athletes say that they have sled head or brain fog that exists on a routine basis. Now I think again we have to stop and think that having concussions or having traumatic brain injuries, even something like banging our head against the wall, some kids with maybe developmental issues or behavioral disorders may tend to be head bangers or floor bangers. I've had a lot of those patients in the past where they would sit and they would have to have some sort of stimulation, so they were constantly hitting their head on something. That creates sustained injuries over time, almost like the brain is suffering from a mild concussion each and every time. And there's a lot of trauma that comes out of it. There's a lot of resultant visual issues that come out of that as well, that affect binocular vision and affect our ability to process information that we're seeing visually. So you can learn about how our clinic works with traumatic brain injury with all kinds of different types of patients. You can go to our website at visionforlifeworks.com. If you happen to have had a concussion or a traumatic brain injury yourself or know someone that has, and you want to contact us, well, you can either contact us if you're not local via going to that website, visionforlifeworks.com, and filling out a questionnaire there, or you can contact us direct and call us on the telephone at 618-288-1489, and we can talk to you about how we might be able to alleviate some of the symptoms and problems that you've had as a result of your concussion or traumatic brain injury. With that, I'm going to say thanks for tuning in. If you don't already, like the video, and subscribe to our YouTube channel. Thank you.